first of our podcasts where we will explore what lies behind the headlines and the hype surrounding our health and care system. I'm Neil Dixon, a former BBC correspondent, chief executive of the King's Fund, the General Medical Council and the NHS Confederation, and more recently, chair of East Kent Hospitals Trust.
And hello, my name's Roy Lilly. I'm a former NHS Trust chairman, and now I write and broadcast on NHS and social care issues. And Neil, we have some big questions for our guest, I think.
We do. I think the aim of these podcasts will be to reflect on, the current challenges, big challenges and debates, and try to engage with some leading figures to understand their perspective and insights, and hopefully shed some light on the enormous challenges that are currently facing everybody working around the health service and indeed for patients. So today our guest is Paul Johnson. He's director of the Institute for Fiscal Studies, without doubt one of the most respected economic think tanks in the UK. I certainly want to understand from him how he views the current predicament of our health services, and given all the fiscal constraints, can this be turned around?
Well, let's start with the easy questions.
Well, we've now been joined by Paul Johnson. Welcome, Paul. I should add that Paul is also a former Director of Public Spending at the Treasury and Deputy Head of the Government Economic Service, so presumably sees the challenges from different ends of the telescope, if I can put it that way. Paul, I think it's fair to say you correctly predicted that none of the major party manifestos are exactly honest about the level of challenge facing the UK economy. What was your take on this budget, and in particular the extra 21 billion for the NHS in England?
Yeah, well, it wasn't exactly rocket science to predict that there was a fiscal problem and that they were going to have to raise taxes or cut spending, and so it turned out. I think the interesting thing about the autumn budget was, for the first time actually in history pretty much, the NHS got the average increase for all other departments. Now, in almost every other spending review, all the way back through until the Middle Ages, the NHS has got more than the average department. So that was, despite the fact, obviously, the cash terms number was big, the percentage increase was not especially big, 3.4%, I think, on average over the 2 years. Now, that will be topped up, as it is always topped up, but it just gives you a sense of the scale of the NHS when you say that 22 billion is just the sort of average increase that every other department got. Obviously, in cash terms, none of them got anywhere near that much, but in percentage terms, that was about bang on. And is, of course, it's a bit more than the NHS was getting over the period between 2010 and last year, but it's, a lot less than it was getting year on year through the new Labour years.
I was just going to say, Paul, although it sounds like a lot of money, with all the other pressures that have come out of the budget that impact the NHS, it's very soon accounted for.
You'll probably know that better than I. Certainly when I talk to people in the NHS, they say in their own minds that's already been spent at least once over, if not more than once over. And this is part of the problem. £22 billion is, from memory, more than the entire budget of the Justice Department, for example, or it's a third of the whole of the Ministry of Defence budget. It's far more than we spend on overseas aid, and so on and so on and so on. So just the increase in the NHS budget is huge relative to many other things that government does, but that reflects the fact that the NHS is knocking on for £200 billion a year. So this is such a big part of government spending that small percentage increases add up to very large cash terms amounts. And of course, if you look over the last 25 years, you look at public service spending, NHS spending has gone up from a bit less than a quarter of public service spending to rather more than 40% of public service spending as it's taken up more and more of the available pie.
If I can remind, the IFS had a report out about 6 years ago which said in order to catch up with what it had failed to do over the previous decade, it needed to spend 4% every year in real terms over the next 15 years. How do you balance that with the constraints, which are obviously on the Chancellor in terms of our fiscal rules and the state of the economy?
Well, it's obviously a huge challenge, and actually what we wrote those years ago was before the publication of the NHS Workforce Plan, which by itself, if taken seriously, and I'm not sure that it is being taken seriously, but if taken seriously, would by itself result in big increases year on year on year as the size of the NHS workforce would increase really very substantially. I think we worked out that if you took that seriously, then by the early 2030s, 1 in 10 of the entire British workforce would be working in health and social care, which is a pretty extraordinary number when you think about it. But this is just a microcosm of the challenges that are facing Rachel Reeves and actually the problems facing other departments. If you look at spending plans beyond this year, what Rachel Reeves said in the autumn budget was spending departments would get rises of 1.3% a year on average. Well, the NHS, of course, will get more than that. And because it's so big, defence will get more and so on. That's basically nil for most departments on current plans. And large part of the reason most departments will get nil is because the NHS is huge and will get more than that average 1.3%. So, of course, it's a huge challenge.
And the nil you're referring to is what, nil in inflationary terms, or not even getting inflation in some cases?
Nil in real terms. So on current plans, many departments would get zero real terms growth. And of course, given the fact that the economic forecast that the OBR makes almost certainly going to be downgraded if the Chancellor decides to meet the resulting budgetary hole by being even tighter on spending, then that will be cuts in real terms to other departments.
So the question is, well, okay, what do we do about it? Do we just carry on or do we something about it? It strikes me that there are two things that we could do to try and address this. One is to stop people getting sick in the first place. And second is to look at NHS productivity. Now, there was a time when the NHS's productivity outshone the economy as a whole, and I'm not sure where we are on that now. The numbers have all sort of been lost in the fog of COVID. But where do you think we stand? I mean, let's look at productivity first. How do you see the sort of productivity factors?
Well, I mean, part of the problem at the moment, of course, is that as far as it's measurable, NHS productivity has dropped a lot since pre-COVID. Now, on the upside, it appears to be moving in the right direction now. So the most recent figures are quite positive in the sense that over the last year, 18 months, things seem to have been getting better. But it remains the case that, given the additional numbers of doctors and nurses and so on that we've had since 2019, we're getting nowhere near the proportionate increase in numbers of procedures. So there still remains, it seems, as far as one can measure it, a productivity issue. Now, there's all sorts of things that may underpin that. I don't think anyone knows exactly what's driven that, but there's a combination of issues with the social care system and getting people out of the beds. There's an issue with the capital infrastructure. We don't have enough beds. We don't have enough MRI scanners. We don't have enough capital of all kinds. I mean, this is all in the Aradazi's report. We're not investing enough in primary care and so on and so on. Now, is an answer, as you say, for people to be healthier? Well, yes, that obviously help, but healthy people become sick in the end. So what you need is for people to have fewer episodes of sickness during their lives, and getting people healthier earlier in life would certainly help with that. But and maybe things like Ozempic will actually make a big difference here. I think there are big unknowns here that could make really big differences. But all of history suggests that spending will just carry on rising, at least for now. I mean, we are not in any sense unique in spending more and more and more on healthcare. I think it's worth saying the UK is not in any sense an outlier.
You mentioned both capital and social care. The story of capital is even worse than revenue spending as a story.
Yes.
It seems to have been raided, it's not been put in, and that clearly is a constraint on productivity. People are working with out-of-date technology in old buildings and all the rest of it. Why have these two issues, both the inability to put capital into the service or without nicking it for revenue, and secondly, not solving the social care issue, which has been discussed for more than 20 years. In fact, a generation since Tony Blair's first Royal Commission.
Yeah, well, big questions. I mean, on the capital front, I think part of this is just the problem if you're giving the NHS a fixed budget, and and part of that is for capital, and you're trying to control overall spending, and the NHS itself keeps coming back for more revenue funding, and you say, well, as the Treasury, we've got to control overall spending, and if you can't keep within that, you raid your capital budget, because the urgent always undoes the important, and it's always urgent to get over the winter hump, to get waiting lists down or whatever. It's never quite so urgent to fix the roof or buy the MRI scanner or whatever it is. And I think it's a signal of a system which is, well, to be generous and just working at the absolute limits of capacity, and to be less generous maybe isn't as well managed and led as it could have been. I mean, it's very hard for me to sit here in judgment on that, but one gets the sense of a system in continual crisis, and systems in continual crises, move money from the important to the urgent. I mean, on the issue of social care, I mean, people always need to remember that there's more than one problem here. I mean, we focus a lot on the issue of some people having to spend a lot of their accumulated savings or selling their house. And of course, that is really important. But the overall level of funding is also absolutely crucial. And that's been cut through cuts in essentially local authority budgets, which have been squeezed very hard, particularly under the last government. To be fair to local authorities, they've had little choice but to prioritise spending on social care at the expense of a lot of other things, but nevertheless, it's nowhere near kept up with demand. And that relates to the third issue about social care funding, which is that it's delivered by local authorities. They have legal obligations in respect to what they can deliver, but this is not a demand-led service. They've got an amount of money which is essentially now randomly distributed across local authorities, irrespective of the needs, and that makes it incredibly hard for them to meet those supposed legal obligations. So there are three very big, quite separate, at least three very big, quite separate issues in the funding and delivery of social care. And bluntly, very often, because it's delivered through local authorities, that's often seen as something which central government can blame on somebody else when things don't work.
So if we look at the picture in the round, there's a lot of talk now in government circles about the relationship between health and social care. What do you think of the prospect of the National Care Service? Do you see that in terms of a solution or a further complication or another interface? Is that likely to help?
I haven't got the first clue what it means. It's just a phrase in a manifesto.
Sure, they do either.
No, well, exactly. And they've got Louise Casey to spend the next 3 decades or whatever it is reviewing it. I mean, sorry, there are many things that make me angry. This is one of the things that makes me angry. So you look back to last July, virtually the first thing Rachel Reeves did was to abandon the reforms to social care, which Wes Streeting had said very clearly that the Labour Party was committed to in the run-up to the election. And of course, the last government also pushed them back deliberately past the election. The cynicism around this is outrageous. But also the public response has been extraordinary. I mean, remember that statement back in July when Rachel Reeves made a number of reforms, a number of changes. One tiny weeny one was to take away the pension heating allowance. One huge one was to abandon social care. And what was all of the focus of all of the press on forever? This small change to the amount of money that relatively well-off pensioners get. Was there a lot of focus on the abandonment of a social care plan that had been worked up for a decade and apparently everyone agreed on? Not a dicky bird. So I think that to an extent that's an answer to your previous question. Why haven't we had reform? Because apparently nobody gives a damn, certainly in terms of the political cost of not doing it. And then the cynicism to appoint a new reviewer after review after review after review and say they're not going to report till 2028. I mean, it's outrageous.
The bit that I find difficult that they haven't grasped, if you're running a hospital at the moment, this is not a minor issue. The Royal Free was saying 20% of their patients. I know some other hospitals have had up to 40% of their patients who shouldn't be there. And that's not just a question of, oh, well, they're there and they haven't moved out and so on. They're actually deteriorating while they're in the hospital. And it means the whole system is completely sclerotic. And I don't know how they solve it unless you solve the social care problem. If you ask some health service managers, they will say, give the money to social care. We need to improve that as much as we need to try and deal with the issues that we're facing.
Can I just say, Paul, before you answer that, I was up in Newcastle last week, Northumberland actually, last week, and the hospital there has got so fed up with the relationship it's got with social services, not because they're not friendly or they're at war or anything, it's just they've got no money. So the hospital has actually started its own domiciliary care company. It's a foundation trust, so they're able to do it. They've started their own company to get people home safely and in one piece. Sorry to interrupt you, but that's an illustration of the extremists that the service is in.
No, I mean, it's clearly part of the problem. And I think, that there are clearly also many, many other problems. And there are problems that aren't just about social care, but it's clearly true. It is one of the things that's preventing the throughput through hospitals. I think there are a whole bunch of other things, but that's certainly one of them.
We used to say the NHS is the best in the world, and it was the Commonwealth Foundation or whatever, an American think tank, which said we were top because they thought we were the most accessible, but it didn't show in terms of the actual results.
It put us top of the table despite showing that we were one of the worst at actually keeping people alive. I mean, that was one of the most bizarre judgments I think I've ever seen.
Indeed. So do you have a picture now? First of all, on spending, because Tony Blair had that ambition, I think they got there, didn't they, of getting good ratings in terms of European countries spending. Where do we sit now?
I'm not fully on top of that, but I think broadly speaking, as a fraction of national income, which is often the best way of doing it, we don't look too bad. But it seems it's always a bit of a mystery to me how we spend the money, because we seem to have less of everything for spending the same amount. So we've got fewer doctors per head, we've got fewer MRI scanners, fewer beds, and so on, and yet we spend about an average amount. Now, part of the problem is that actually we pay our doctors quite a lot by European standards, but I think a bigger part of the problem is that our economy's done very badly. So X% of national income is a smaller amount of cash than it is in some other countries. And the other thing which is always very striking about our health spending is that, in most things we're kind of mid-Atlantic. We're sort of between the US and Europe, but in health we're more European than the Europeans, in the sense that we got a very small fraction historically of private spend in terms of top-ups to what we do, though arguably that may be changing at the moment.
Do you see there's a benefit in having a sort of mixed economy with getting people to pay for some of their care?
Well, I worry that we're moving there by default. Now, it's easy to overstate this, but it's fairly clear that more people are making use of private provision, those who can afford it, because waiting lists are high, because it's hard to get to see your GP, and so on and so on. So I think there's at least a concern that we're moving by accident to a system in which the private sector plays more of a role, rather than perhaps a managed system in which maybe better off people would pay something towards the health. Now, I'm not proposing that as a way of going forward, but with our complete inability to have a sensible discussion about this, I think, is one of the problems which has actually haunted the health service since its inception. This idea that we are, in some sense, so special about this. Of course, nearly every country in Europe has, broadly speaking, a health service that's free at the point of use, but might have some top-up insurance, might have some upfront payments which then get refunded or what have you. But the idea that we can even discuss that here is just out of the window, and therefore we are where we are.
It's a really interesting point, this, because I remember when Virginia Bottomley was the Secretary of State for Health, and she fell out with a dentist, and she said they were drilling for gold, and there was a problem with their contract, and they were actually making quite a few quid out of it. But he ended up with a punch up with the dentist, which ended up with them going to join in their droves a very small little insurance company called Denplan. And suddenly everybody was offering private dental care, because dentists, unlike GPs, dentists can actually offer private and public services in the same place. GPs aren't allowed to do that. And that's really how we got into the mess we're in with dentists now, that it was the dentists who said, we've had enough of this, we're going to go into an insurance-based system. And now there are lots of insurance companies that offer it. What worried me was I saw some numbers the other day where the percentage of people that have gone to get a private GP is 14%. And it's gone from like 2% or something. I mean, it's really exploded in the last 18 months. And that's really, for me, quite worrying, because that means that, GPs are migrating out of the service into their own private practice. I mean, I live in central London, and I'm surrounded by private GP practices.
And I don't know about those particular numbers, but that's exactly the kind of thing that I mean by an unplanned move to greater involvement of the private sector. Now, part of that is that you can do this online now with private GPs, so they're more accessible. You don't actually have to live next to Harley Street or wherever you live to access them. But it is it's a sort of consumer response to a very poor public service in some areas. I mean, we've all got different experiences. I've moved from one part of North London to a part very close, from a absolutely appalling GP service to really quite a good one, just because I've moved a mile down the road, and different people experience different things.
I think that variation in performance in itself is quite interesting. Just before we go off the international stuff, Is there evidence that a different funding system would somehow drive greater efficiency or bring more money into the system or whatever?
I honestly don't know the answer to that. I don't even know how to think about the answer to that, because it will be so difficult to move from where we are to, it depends what you mean by a different funding system. You could say, well, let's move to a social insurance system. Well, in the UK, we don't really have social insurance or anything. So we used to have sort of social insurance for pensions, unemployment benefit, and so on. We don't have that now. And what that would mean quite for health, very hard to get one's head around. And then you could have a thing where you could have something where you've got some sort of top-up payment. So if you're relatively well off or some on some measure, then you pay. So I mean, think about social. I mean, you can think about it in the social care context. So what were the Dilnot proposals on social care? It was you pay the first X £1,000 and the final proposals were £86,000, and then the state picks up the rest. Well, you could think of health like that, couldn't you? You could say, well, perhaps once you hit pension age, and if your income's above X, you pay for the first X £1,000 in the health service, and then the state will pick up the remainder. Now, again, that's not a proper proposition, but it's something that one might want to think about. At the moment in social care, you pay the whole lot, and in health, you pay nothing. Now, it's not obvious that either of those extremes is the right place to be, but we seem to be stuck at the extreme in each case. And could you move away from that? Again, to raise the question is, I mean, certainly if you're a politician, to raise the question is to lose the election. But it's something that if you're thinking about that in the social care context, and health and social care certainly have some things in common, why can't you think about it in the healthcare context?
Interestingly enough, I suppose the nearest political party which does seem to be making ground is Reform UK, and they've certainly, I think, questioned some of the basis of the NHS, but it'd be interesting to see whether their popularity would survive a real challenge to free at the point of delivery.
Yes, I'm not clear how much their potential voters have gathered that. I mean, Reform manifesto had absolutely massive public service spending cuts within it. They were never challenged on. But, anything outside of the top the two main parties get very little challenge on their policies. And just to be politically clear that this is not a particular point about reform, the Greens were at least as bad. I mean, once you get to the sort of more populist parties of left or right, they do tend to make wholly implausible promises, but don't really get properly audited.
As you look forward now in terms of the health and care system, one of the things we can say is that it is sometimes quite difficult to predict, and perhaps especially now, where the economy is going. So we may have grand NHS plans of this is the kind of funding we're going to go forward. But of course, we could have another shock of one kind or another, which would mean that these best laid plans simply don't materialise. So the future for the health service and for social care, is it fair to say it's as uncertain as it's ever been?
If you read, as I know you have done, histories of the NHS, it goes through periodic crises and periodic periods of things have never been worse and so on. And it feels like we're in one of those. I'm not sure. The truth is the NHS is performing better than it was in 1996. I mean, I know things look bad, but it's much better resourced. We don't have people waiting years and years and years on the whole, and there are twice as many hospital doctors and so on. But the challenges are going to keep on coming. The population is getting older, the costs of interventions are growing, and of course we've got uncertainties with the economy and a real struggle with the public finances. I mean, the difference between now and 30 years ago is debt is very, very much higher. The taxes are very much higher. Overall spending is much higher, and yet public service as a whole still are really struggling. And it's that combination of, we've got the highest taxes ever, and we've got high spending by historic standards, and yet nothing works.
Looking forward to the future, perhaps we could do that, perhaps with a tinge of optimism, I don't know. We're waiting now for the great master plan to be published in the spring, although I hear it's being pushed forward to the summer. The new NHS plan. I don't know what's wrong with the existing NHS plan, but anyway, we're going to have a new one. There are three principal shifts in it: from the hospital into the community, from analog into some kind of digital thing, and into a greater prevention. Have they got the three things right? Because it seems to me these are the three things that we've had a go at since the day and hour I've been involved in the NHS. I mean, there's nothing new here.
If you look back at Aradazi's review in the autumn, he recommended all the things that everyone has always recommended. You need more capital spending, you need more focus on primary care, you need to get the technology right. And we've been saying that forever. And he recognised that. He says, I know that everyone has always been saying this. We really have to do this. I mean, the primary care thing, I think, is a great example, or terrible example, where I think every Secretary of State for as long as I can remember has said, we've got to move resources out of hospitals into the community. And every single one of them has done exactly the opposite. We now have, I think, fewer GPs per head than we had in 1997 and twice as many hospital consultants. Now, maybe that's the right thing to do. I doubt it, but it's certainly the precise opposite of what everyone said they're going to do.
But it's not any cheaper to do it. Someone who's sort of run a hospital and been involved with the health service, the hospitals still have to do what hospitals have got to do. If you want to give some of it to GPs to do it for the hospitals or instead of the hospitals still have to do it. So you end up with horrible dual running costs. It's not any cheaper.
I'll take your word for that.
I promise you it is. The technology piece, of course, is the other area where the NHS has wasted or failed to invest wisely. Billions of pounds we've had Connecting for Health, which was a hugely expensive experiment that didn't go right. Then we had data.com, which later followed it to try and make use of NHS data more wisely. Why is it that we're so bad, do you think, at investing in technology? And does anywhere get this right?
I don't know about anywhere else getting it right. I mean, two things on technology. One, I mean, again, as you all know, I was part of the Times Health Commission a couple of years ago, and there are two or three things that, you do these things and actually not very much sticks in your head. But one of the things that stuck in my head was just how fed up every single person in the entire NHS was with the IT systems that they've got. And that wasn't because they're not using cutting edge AI. It was because they can't turn their computers on, or, that one database won't speak to another, or very, very basic stuff that doesn't work. I mean, the other thing that really stuck in my head was that they all thought it was appallingly badly managed from a human management point of view. So I think there's the difference between the high-blown rhetoric of the politicians, which is, we need to be world-leading in terms of the technology we're using, and the experience of staff, which is that we're still in the 1930s in terms of technology that we're using, and actually getting to 2010 would be a triumph. I exaggerate a bit, but I don't think I'm exaggerating hugely in terms of that. And then, in terms of what goes wrong, way beyond my expertise, but I think they're part of it is this disjuncture between, or this uncertainty about whether is this a single beast where you're trying to get a single IT system, all of which is fully integrated, which I think is what the Blair government tried to do, and huge failure. Or are you giving real devolved power to all of the different trusts and hospitals and so on to develop systems which might not work together? And I think that uncertainty between those two things is potentially creating the worst of both worlds. But I have to say, I'm way off my area of expertise here, so I may be talking absolute nonsense.
Well, you are right in saying that the NHS for some while was one of the greatest users of fax machines in the 21st century. I hope it's all gone now, but it is astonishing that you were still finding places having to do that. I think it is also true to say that as of today, people are still receiving letters where they could easily receive emails, and that the NHS is still very analog. And the government, seems to me, is absolutely right to say that we should do that. But then Tony Blair said that in 2000.
Well, I was listening to the radio this morning, and apparently most fax machines are actually now using. I mean, Germany in general appears to be the last country still dependent on fax machines, alongside possibly the NHS.
Now, I'm conscious we're coming perhaps to the end of our time with you, Paul. Look into the future for us. Give us some thoughts.
I haven't got a crystal ball in front of me, I'm afraid. Look, in the near future, we're just over a month away from the spring forecast. It's almost certainly going to present Rachel Reeves with a horrible problem in terms of her spending and tax plans. We're then going to have the spending review in June. That's where we're going to find out what the plans are for spending on health and all the other public services over the rest of this Parliament. And that's going to be tough for everyone. And, one of the issues for the NHS, as we were saying, is, you slice 1% off the NHS, you've got quite a lot of money for everyone else. So that's going to be a risk, as it were, for the health service. We'll then see where on earth we end up with social care. But looking into the medium to long-term future, the pressure on spending is only going to grow. And this is one of the places where we just have to have a much more grown-up conversation about the choices we're going to make. And that's something we wholly failed to do in the run-up to the last election, and nobody really wants to do now.
Very true. Paul, we're enormously grateful to you for your time, and thank you for talking to us. You're leaving the IFS, aren't you? You're moving on?
I am, I'm afraid, yes.
What are you going to do?
I'm going to go and be head of Queen's College, Oxford.
Well, that's not a bad job to have, is it?
Yeah. Well, we'll see.
Perhaps you'll come back and talk to us when you're there.
It's going to be a big change in life, so we'll see. We'll see how it works.
Well, I'm sure on behalf of everybody listening and Neil and myself, we wish you all the very best. You've been a huge, I don't know how best to describe it, really. I was going to say a bastion of clarity, but I'm not sure those two metaphors mix. But you've been someone who's been able to explain the intricacies of public expenditure in a way that we've all been able to understand it. And we will miss you doing that. But all we can do is to wish you all the very best. And thank you very much for joining us today.
Yes, thank you, Paul.
Thank you.
Very interesting reflections. I don't know what yours were, Roy. I certainly took from all that internationally, we're not doing very well. The amount of money, which sounded huge, 21 billion, is not huge in terms of the percentage increase for the health service. It just seems huge because the budget is huge. That social care still on the back burner, and you can almost hear, as a very objective observer, his frustration with all that. And then questions around productivity and how you drive productivity into a system which has got such huge underinvestment on the capital side. And then moving forward, great uncertainty. So there wasn't an awful lot optimistically to hold on to in terms of how we go from here and the ambitions which they obviously have around the health service. And how does that actually mirror with the economic realities about what they're able to fund? And funding, it seems to me, absolutely critical in terms of the NHS may be inefficient in some ways. Some of the oil in the engine may reach the road. But if you do not put the oil into the engine, it starts to heat up, and that makes it more inefficient.
There was a question, actually, I wanted to ask him and I didn't, and I wish I had, because I think the damage was done to the NHS, the structural damage was done in the 10 years following the world banking crisis, when we had really under 2% funding. And that was when we didn't hire enough people, enough doctors, nurses, buy enough kit, repair enough buildings, all the stuff. And the chickens now are coming home to roost, because we forget, don't we, that we went into COVID with waiting lists at 4.5 million and 40,000 vacancies in nursing. And I remember doing programs when people were saying, this is outrageous, 4.5 million. Oh my God, the roof's coming in. Wouldn't we like 4.5 million people waiting now?
Yeah.
It's got a lot worse. And I think that was when the damage was done. He's a fascinatingly interesting guy to talk to, and he's very objective about it. One of the impressions I got was really the politicians have got to be a bit braver in the choices that they make for the NHS. And one wonders really whether or not it is only a Labour administration that could make some of those tough choices, as unwelcome as they might be. Do we look to Labour to make those choices?
Well, I think that's true. I personally think that the reorganisation which was carried out, the so-called Lansley reforms, were themselves an impediment, perhaps a disaster, I don't know. They were an extra thing that made things more difficult rather than easier going forward. So that was one thing that went wrong during that period. I remember having the discussions around just after the crash in 2008, where we all recognised that we were going into a period of austerity. Even under a Labour government, it was talked about. And indeed, I think it was the IFS, they'll correct me if I'm wrong, who said it would take at least 10 years. It was certainly a view with ours within the King's Fund at that time, that we would have 10 years of relatively low growth, and it wouldn't succeed in the same ways in attracting money that it had in those first years of the century. But the reality is that although the system was more robust at that time, it wasn't sustainable. As you say, by the time we got to 2018, the thing was lying in all sorts of difficult positions and not able to meet what had been massively growing demand.
Well, what an interesting session. I don't know where the time's gone. Listen, if you're listening, I hope you enjoyed it as much as we did. And we hope that you'll join us next time, where we'll find some big people to answer some big questions. So from Neil and me, thank you for listening, and we look forward to seeing you next time. Bye-bye now.
Bye-bye.